My name is Dan Sciubba, and at Northwell Health, I represent the neurosurgery department as the chairman and the senior vice president for the service line. What North Shore University Hospital offers is the top in care for neurosurgery across the country, which means that anyone in the metro area of New York does not have to go any further but down the street to our facility. With our brain tumor patients, the ability to integrate all of our imaging and all of our navigation so we can pinpoint exactly where the pathology or the harm or the tumor is and avoid all the other aspects of the normal brain becomes much more specific. The other half of neurosurgery, other than cranial surgery, is spinal surgery. And what we're seeing in spine is what I think is two aspects that continue to divide in a good way. The very minimally invasive, get the patient in and get them out and maybe have them exercising the next day or going to work the next day. That is one opportunity. And the other is the more complex scoliosis, deformity, fractures, and what I focus on, which is spinal tumors. With regards to movement disorders such as Parkinson's disease and essential tremor, we now have something called high-intensity focused ultrasound, which doesn't even leave an incision because it's done through the skull with ultrasound in a very specific way. With regards to new programs that are exciting, one area is pulsatile tinnitus. And we've been on the forefront of that here, where we treat patients with minimally invasive techniques. And this takes patients who are truly debilitated by this and puts them in a normal setting. What this new facility does at North Shore University Hospital is it co-localizes all these complex teams together so the communication is faster and more efficient. And the patient doesn't even have to see the interruption from one care to the next.